All right, and we are live.
Hi, everyone. Thank you so much for joining us. My name is Chanel Jones. I am an NBDA birth doula and trainer. I'm so glad to be here. Thank you so much for coming to our masterclass on Doula Notes. And so please go ahead and advance to the next slide. And I'm going to have Vanessa Beard-Streeter introduce herself and why Doula Notes came to be. Actually, you can advance to the next slide as well. Thank you. Vanessa.
So good evening, everyone. I'm so happy to be with you this evening as we have the opportunity to, facilitate a masterclass on Doula Notes. And so, particularly in New York State, when Medicaid reimbursement became available for doulas, we really wanted to engage those who had been previous doulas without Medicaid reimbursement or being Medicaid enrolled. We wanted them to consider becoming Medicaid enrolled. And we also wanted to ensure that we were helping and expanding the doula workforce in New York State. And so we had the opportunity to meet with doulas, talk to them, figure out what were some of the barriers as to why they did not want to become Medicaid enrolled. And in those conversations and the focus groups that we met with, one of the questions or one of the issues was, I don't really want to deal with the administrative burden of billing for a Medicaid, right? There's a high audit rate. I don't really want to deal with that. And so as we had conversations with doulas, we started to realize, you know what? Addressing the administrative requirements as it pertains to doulas, helping them to schedule their births, helping them to be able to communicate via a platform, via text message and email, allowing notes to be able to take place within a platform, having pre-populated CPT codes that are associated with the services that you're offering would really make it easier for doulas to focus on the work that they need to do, which is really taking care of our moms, right? And making sure that we are addressing prenatal, during birth and delivery, labor and delivery, and postpartum. And so what we did was we had the opportunity, there's a gentleman on here with me, and we had the opportunity to meet with Derek. I do know him very well. And when we were meeting with Derek, I said, Derek, you have an IT company, and what we really need is a platform for doulas to make it easy and to remove that administrative burden as it pertains to addressing their clients' needs, and making it easy for them to do the work that they need to do. And so within the matter of seconds, he said, of course I'll do it. And he also said, I'll do it for free. So I also knew his philanthropic and his altruistic heart. And so I knew that he would be willing to assist and work with us in creating a platform that was just going to make it easier for doulas to be able to manage their clients and provide their services. And so we created Doula Notes from what doulas told us that they needed. Chanel, along with a couple of other doulas and a midwife, they helped in developing the platform. So making sure we were including the information that was needed, the drop downs that were needed, including all of the information that was going to be helpful to a doula as they're managing their client base, and also as they are providing the services to the individuals that they're servicing. And so this platform was designed by doulas, for doulas. Our organization, Health and Welfare Council, we have some initial funding. Even though he said that he was going to do it altruistically, we realized it's a lot of time that is spent in creating this platform. So we provided some foundational money, but we also wanted to offer this platform for free, particularly in New York State, for doulas to become Medicaid enrolled, because we needed to grow the workforce. And so that's what we were able to do. We have, at this point in time, about 78 doulas that are currently using the platform. We just graduated a class with Chanel's expert training of additional 24 doulas. So by In the next couple of weeks, we'll have more than 100 doulas that are using the platform. And we're hopeful today that this presentation and masterclass helps you understand why it would be important for you to use this platform as well, and how it can help to make your job easier. And so the person that I was speaking to in reference to owning his own IT company, which is Sonar Technologies, is Derek Peterson, who's on the screen with us this evening. And I just turn it over to him. One, I say thank you, and I tell him this all the time. Thank you from the bottom of my heart for your willingness to say, I did not realize the disparity in birthing outcomes, and I want to be a part of this ecosystem in addressing those disparities and the trajectory of birthing outcomes. And so, Derek, I turn it over to you just to introduce yourself, and then we'll turn it back to Chanel for the masterclass.
Hello, everyone. It's a privilege to be here and to be able to talk to all my doulas and listening to the masterclass. It's been an honor just to be able to work alongside Vanessa, Chanel, and all the other doulas to build this platform. It's as I continue to get educated in the outrageous unequal justice with our population, I want to do more. And so I welcome everybody to listen to Chanel, take advantage of the program, of the package, and then give us your feedback and input to how to make it better, to make your lives easier, to have better birthing outcomes, which is the goal. And I'm here for you. I'm Chanel's backup, Vanessa's backup, and let's make this happen.
Awesome. Thank you so much, guys. If you could actually advance to the previous slide, these slides got a little out of order, and I just want to show you the initial login screen. So if you could go back to the previous slide. Thank you. Perfect. And so what you're looking at is the initial sign-in page for Doula Notes. To navigate the website, this is what you will find when you first log in. Wonderfully done. If you scroll down that page, you will find videos on how to use the website, on how to log in, and how to sign up. And so it's a straightforward platform, and we're so grateful to have it, especially as a Medicaid provider, and for documenting your chart. And so if you could advance forward 2 slides, I'll show you what that looks like. And so what you're looking at is the home screen of Doula Notes. And so since this picture was posted, there's a lot more tabs in there for the calendar and for tracking mileage. But you'll see upon opening it up, we have real-time clock tracking for proper documentation purposes. You want to make sure that your notes are getting in and that you can timestamp them. You have your client overview, so your total clients, your active clients, and then you have your lead overview, which are leads that come into your chart from a link that's generated from your provider account. And so you can post it to your social media, and that's how you get people to inquire about your services. So not quite yet your client, but on the way to. And so that's what leads are. And so it's a wonderful way of keeping track of all those things. If you want to advance to the next slide. Thank you. And so the clients tab, this is a great overview of your clients. As you can see on your screen, the client view, it breaks down the client name, their expected due date, their plan number, right? Their hospital or birthing center that they're going to be at, emergency contacts. And then you're also able to view, and it's a little smaller on my screen. If you see me squinting, that's why. But you're also able to add in notes about your client. You're able to view history on your client, like any past conversations you've had. You can send notifications to your client. You can even send text messages along with emails to your clients. And you can edit your client's chart. And so when you have multiple clients where it says all clients, it even breaks it down by little, we call them tags. And so if you wanted to create a tag for each individual insurance company they have, you want to create a tab for all their pregnancy complications, so preeclampsia, gestational diabetes, GBS positive. You could create tabs for that. And then when you pull up their chart, you could be like, oh yeah, this one's having a boy, they have preeclampsia, and it's right there, forward-facing information for you. So it's wonderful. And so if you move forward to the next slide, you get a better view of what your leads will look like as they're coming in. You have inactive ones, maybe ones that decided to go with someone else or that you decided to forward to someone else. The ones that say submitted is a new lead, right? And pending, you have pending leads, potential leads that are in there, but you can assign them to you. And once you assign them to you, they are your clients and they will populate under the client portion of your chart. We talked earlier about the doula consultation form. That's that lead form that somebody can fill in their information, like is it their first pregnancy? Where do they live? Who's their emergency contact? What insurance do they have? What language do they speak? It's wonderful because you don't have to go seeking your clients. They can come find you by clicking on the link that's generated from your Doula Notes account that you can post to your social media. So it's a really wonderful way of passively, we call that like passive income, but passively recruiting new clients for yourself. And so if you click on the next slide, you'll see the tab that shows you the nice birth tab that shows you the expected due date, and the delivery dates can be put in for your clients. And so it's just a nice way to track all the clients that you have supported or will soon support, and a way to track like what their expected due date was versus when their baby actually came. Why it's wonderful is because data is important. The more we can collect data, the more we can fight for, higher Medicaid reimbursement rates as providers. And so it's wonderful that we have a one-stop shop for all this information. And so if you move forward to the next slide, you'll see the calendar, which is wonderful. You can put in all your appointments on the calendar. You can block out dates for when you're on call. You can add in appointments here for the next upcoming appointment. You add it to the calendar. And you can also document that accordingly as well. And it's a wonderful feature. It's really great to pull up your calendar and say like, okay, I'm really heavy this month, or I know this person's expected, or this is coming. And so it's just a great way. Again, everything's all in one place, and you can track it better as opposed to my Google Calendar, which is inundated with multiple calendars of events. This is great for just my doula clients. I can go in and see what's going on there. And then so for the next slide, if you could please advance. Wonderful. We have a Doula Notes directory, which we're currently working on, where you're going to be able to put your picture up there, a little blurb about you, what kind of services you provide, whether it's postpartum, birth, placenta encapsulation. You're going to be able to say what languages you speak, what insurances you are a part of and accepting. It's going to be wonderful. So this is a new feature that we're currently working out, all the kinks, but as you can see, we do have some examples in there, and it's wonderful. And with that being said, I'm so excited to be a part of this because as a doula who helped contribute to making this platform possible, along with Health and Welfare Counselor and Derek, we get to have a say. So if there's a feature on the platform that you would love to see, or you have suggestions, Derek is amazing with making it possible. And so that's what I love about this platform, because it's not, he's not just doing it it's not just a business to him. Like, he really wants to make sure that as doulas, we have a voice and that we have a system that works for us and not against us. And so I just love that we have that flexibility and that our voices still matter, and how we can properly support and document our visits with our clients. And with that being said, I'm going to ask you to advance to the next slide, and Derek is going to share with us the wonderful additional feature he's been working on. Derek, take it away.
Sure. Okay, very good. Nice job, Chanel. So as Chanel mentioned, that every feature you've seen so far that she highlighted has been a joint effort. So as doulas continue to come on, they ask for a new feature, we added to it. So over the course of, I believe it was the last 2 years, the product's been growing, and it's still growing. And with that said, we've grown into another aspect of the product, and we're calling it Sentinel, where this is going to allow you to better understand what's going on with your clients, the birthing mothers, meaning that we've done enough studies and I have other products that we work on that allows us to do what we call remote patient monitoring in regards to respiratory monitoring. And so we're able to monitor a birthing mother's respiratory system by them actually, I know it's going to sound kind of futuristic, by them coughing into their own cell phone. And then by doing that, we're able to analyze their lungs, analyze what's going on in their body in regards to the respiratory system, and then report back to you and other care physician of care. And so that's what Sentinel is. Sentinel comes along with the tool. And also, do you have another slide here, Chanel, too, with this in Sentinel?
Yes, please advance to the next. There's 5 total, so if you want to slide through them.
Okay, so I don't know the whole format of them all, so I'll just continue to talk. So you advance when we need to advance. But anyway, so what Sentinel is going to work is that in the Doula Notes, there's a link there to connect to what we call IASA Notes. And when your clients connect to this new platform, they can build an account in IASA Notes. And what IASA Notes does, it allows them to track their progress as they're giving birth. I mean, as they're giving birth, but as they're going through their 9 months of pregnancy or so forth. And so it becomes their overall digital command center or health command center for that whole process. And so inside that application and that platform, there's a button or a feature called Sentinel or ISO Breathe, which allows us to go ahead and monitor their lungs, the lung capacity. And in doing so, this is what we call a feature called RPM, Remote Patient Monitoring. And you think about, with the remote patient monitoring, we've partnered up with also another medical practice that can actually do the remote patient monitoring. So your client will cough into the phone, get that analyzed. That data then goes to a certified doctor office. They'll do the analyzing of this. And then because of that, they're able then to bill insurance. And we've worked it out with the carriers that you will also receive revenue based off that billing. So when your clients use this tool, it's additional flow through passive income back to you as the doula. So it's 2 hands. One, it's doing something really great for your clients, but also then it's also returning a passive income stream to you as the doula. And then when we have another date or something like that, I can go into a lot of depth and detail about that platform and how it can really be used for your clients, because that platform has so many features that will benefit your clients. In fact, inside that platform, we're rolling out a piece of what we call AI to actually monitor your clients to see if there's any depression going on, postpartum symptoms like that, so that we can report back that to you and report that also back to a caregiver. Next slide. Alex, I'm done here then.
Thank you, Derek. That was the last slide. And so thank you so much for your presentation. Definitely love the seamless coordination and the passive income. Definitely a wonderful help to all doulas who we know are doing one side hustle after another. And so how great to have this platform. So thank you so much, Derek. And now we're going to talk about HIPAA compliance. Tonight is jam-packed with a lot of good information. And so I know we're rushing through it, but I'm so glad that you're here because we need to hear this, right? So as a Medicaid provider, HIPAA compliance is very important. And so what is HIPAA? HIPAA is Health Information Portability and Accountability Act of 1996. It's a U.S. federal law that protects sensitive patient health information from disclosure without consent. It mandates security standards for protecting data, privacy, security rules, and enables coverage of portability when changing jobs and reduces healthcare fraud. In other words, it just protects patient health information, and it applies to written, verbal, and digital information. And if you could advance to the next slide, we'll talk about some of the rules of HIPAA. Yes, thank you. So one of the 3 rules is privacy rule, right? Making sure that your patients have a right to confidentiality, keeping track of their disclosures, minimizing the amount of information you share, and notifying the use of their patient health information. It has to be safeguarded administratively, physically, you have to keep it safeguarded, and technically, right? And so if there's a breach of this information, it's regulated by the Office of Civil Rights. And so you have to inform all impacted individuals and notify your local office. This is really important to know just in case you do experience a breach. But we're going to talk about ways to avoid that. So if we could just advance forward to the next slide. It's really important to remember that as Medicaid providers, as doulas, our services include prenatal visits, labor and delivery, the birth support, postpartum visits, and this must be documented clearly. I'm going to say that part again because I feel like obviously we're not doctors, but because we are Medicaid providers and we're venturing into this field, it is important that documentation be something that we get really good at, right? For lack of a better phrase. And so PHI in doula work includes your client's name, their due date, their birth stories with identifiers, and text messages about labor. So any communication between you and your client is considered PHI. And if you could advance to the next slide. Thank you. HIPAA compliance practices is make sure you always get written consent. Make sure you use secure encrypted communication methods. De-identify information if you are going to share it. Only share patient health information, PHI, when necessary. Be mindful when you're in the community settings, when you're sharing about clients, and maintain proper documentation for record keeping and billing compliance. And if you could advance forward to the next slide. I made a little sample of what a doula client HIPAA consent and confidentiality agreement looks like. And so it's important that it states the disclosure of your health information, right, for the purpose of care or coordinating services or for Medicaid billing. You have to have what information may be shared, which is their name, their contact information, which includes their address, telephone number, information about their pregnancy, and any notes or documentation that you may need to report for auditing. How this information will be protected, right? You're going to have secure storage of records. You're going to use private or encrypted communication and limited sharing on a need-to-know basis. And the client has rights, right? So they can request access to their records. They can revoke consent at any time. And they can ask questions about how their information is used. You have them sign and date it, right? And they're giving consent, and it's all written there. And so you want to make sure that your form has all that information listed. If you could please advance to the next slide. I wanted to talk about media and HIPAA consent. It's really important. If you don't have one, if you haven't used one, it's absolutely necessary. There should be no sharing of your patient information if you don't have consent. That is a separate consent form, and it's necessary that it states and gives them the option of what can be shared. Like sometimes people don't want you to share the front of their face, but they don't mind a back silhouette. You know, they don't mind a shadow or pictures of hands, babies' hands and feet, those kind of things. And so some people don't mind sharing their breastfeeding photo for you to share on your social media page, but other people do. And so you want to make sure that you have a consent form for your media and social media content, and anything that you plan on putting out to the public. You should have a separate consent form for that. And so if you can move forward to the next slide. I just want to reiterate that your clients have rights, right? Right to privacy, right to access records, and to revoke consent. And as a doula, it's your job to work ethically in this space, to hold space without judgment, to maintain boundaries and professionalism, and to protect confidentiality always. Okay, that is the goal. as HIPAA compliant practitioners. And so if you could advance to the next slide. And I know we're running out of time, but we're almost done. I just want to remind you to please use secure information, use encrypted apps or consented communication, and avoid discussing clients in public or on social media, especially if you don't have their consent. Or even if you're on an elevator, just don't do it. If you're talking about somebody, just try to keep everything, avoid discussing clients in public spaces, or on social media, especially if you don't have their consent. Okay, it's really important. We maintain their privacy at all times. You never know who's listening. And so I just want to give an example. If you could advance to the next slide. For documentation purposes and billing examples, a bad example of documentation is in your notes putting client is unstable and emotional. But a good example is like the client is reported increased anxiety and you provided breathing techniques. This is great documentation. It's short and sweet, but it gives a full picture as opposed to saying that your client is unstable and emotional. And then for documentation for your billing purposes, you do need to note visit time and type and services provided. You cannot bill if you have missed or shortened visits. These things are important to know that for your prenatal visits, it's a minimum of 15 in New York, which isn't great. As providers, we know we spend more time with our clients than that, but nevertheless. And so, and then postpartum is 30 minutes. Again, make sure that you're documenting your visits and that you're accounting for your time. That's the best way to avoid doing it incorrectly. And if you could advance to the next slide. We talk about breach response, right? If there is a breach, then you want to act immediately, notify your local office for civil rights. You want to document it, and you want to follow all reporting protocol. And so for New York, it requires a business to report the data breach, involving private information and medical and health. And it's affected residents within 30 days of discovery. While most people federally follow a 60-day timeline, you must at least notify the Attorney General within 5 days of the breach. And so if you advance to the next slide, I'll give you a quick case study, and then we'll leave room for Q&A. And so case study 1, the doula posts long night at the hospital with insert client name detail that you'd never had consent for, right? Yes, that is a violation. You shared identifiable information and you did not have consent, right? Case study number 2 is doula leaves notes in a car visible to others. This is a risk. This is improper PHI storage. You should always have a folder, binder, lock and key that if you're traveling that you can secure client information in. And so these are just some quick examples of how to stay HIPAA compliant. And I'm so grateful that you took the time to meet with me to discuss this. And so I would love to advance to the next slide so we can discuss your Q&As. Thank you so much, everyone. Welcome back, everyone. The gang is all here. And so now we're just going to go over some questions from the audience.
So Chanel, I just wanted to say one, great job in presenting. You had to present a lot in a very limited amount of time. So a great job in presenting. I think a couple of things that I just wanted to highlight. When Chanel spoke about the leads, right, and the opportunity for you to have a specific URL that's associated with your business that you can put on your website, when people fill out that form, that lead within Doula Notes will come directly to you. And so therefore, you're not having to input the information that's created as part of your website. So you would be able to have the Doula Notes lead on your own website. So I think that piece is, she spoke to it, but we had to go really quickly. So I think that piece is really important. I also think too, like managing your schedule when she's talking about the calendar that you see, that is so helpful because it really helps you to decide whether you're going to onboard clients or not, depending on when that person's birth is, scheduled for. And I think those are the things that we need to be able to see and visually see so that we know that we can actually make the appropriate commitments to the client base that we're looking at. And then, Chanel, you were great in reference to your consent form and providing us HIPAA compliance. And just think about it, through the Doula Notes platform, you could easily send a link to that consent form and have your client complete it, right? And then you'd have documentation that you sent the consent form. And then if you needed to follow up on it, you can put a tag to follow up on it. So I just kind of wanted to extrapolate from your presentation, Chanel, just other ways that the platform can be very helpful for you.
And just tagging along with Vanessa said, with the consent form, we're adding consent forms to be built into Doula Notes. So you'll be able to generate it automatically and send it to your clients, and they can fill it out electronically.
Great.
See, this is why I love the platform. We got ideas. Derek puts it to practice. Thank you so much. Thank you so much for that too, Vanessa.
Yep.
There's so many ways that you can use the platform. It's great. And then if you have ideas, Derek is there ready to implement them. So.
And I think the other thing that Chanel spoke to that's really important as well is that the advocacy around being able to, anonymize the data, but being able to speak to what are the outcomes when doulas are involved in prenatal and the birthing process, right? What do those outcomes look like? When we're able to aggregate that information, that allows us from the standpoint of advocacy to really advocate for higher reimbursement rates. We're looking at commercial insurance, right? So United Healthcare is one of the first commercial insurances that are looking at, that have, for a certain subset of the population, started reimbursing for doula services. But the more data we have, the better position that we can be in to advocate for reimbursement just in general, particularly with our commercial insurances, and definitely from the Medicaid perspective of higher reimbursement rates as well. And it's really important because it's an MWBE platform, right? So it's a minority or women-owned business platform that we are supporting ourselves, right? It is a community and it's a collective. So I think that's really important as well.
Awesome. Thank you so much. And so I know that we're coming to a close soon. Just wanted to see if we had any questions from the audience.
Yes, thank you everyone for such an informative masterclass. Our first question is, for doulas who are new to digital client management systems, what are the first steps to confidently integrating platforms like the Doula Notes app into their practice?
Somebody want
to know?
I was just going to say easy. It's an easy way to do it because it's very straightforward, and it's simple to use. And so just like you would have someone, I think the greatest part I love about the platform is the leads. Like I have my website up, and so instead of like someone contacting me saying, "Hey, I'm interested in a doula," they just fill out the leads information, and I have all the information I need to plan moving forward. Like I know when their due date is, I know what their insurance is, I know what town they live in. And so it's a lot easier for me to calculate, am I going to be able to support this person right out the gate, or am I going to refer them out? So for one, I love the leads. That was like the first thing I set up when I created that account. And then secondly, just like you use all these other apps and stuff for what you're currently doing, this is just a one-stop shop for that. And so for me, it was an easy implication, to implement it, because instead of going to all my different Google Drives and things that I had, I just clicked the tab and just found what I needed for each client there. So it is pretty straightforward, the use of it. It's easy to use. So I think that you would have no problem switching over to using the platform. I think it would be an easy transition for sure.
But also, if I can just chime in there, I think that the question also stemmed around from going from a non-digital age to now doing something digital. So it also has to become a committed mind shift. So you're going from loose pen and paper to now putting something more organized and structured. And in the long run, it's going to help you when you think about your Medicaid billing and your insurance billings, because you need to have everything categorized, you need to have everything organized. So it is a little bit of a mind shift, But as Chanel just mentioned, the platform is very easy to use to get that done.
Yes. Thank you so much, Chanel and Derek. Um, Next question is, how can AI-powered tools like Sentinel and the IASO breath analyzer support early intervention and improve outcomes for pregnant clients and newborns?
So what's going to happen with that is that we're going to be collecting. So ISO breath will be monitoring respiratory symptoms in the birthing mother's lungs. And so therefore, we're going to help with early onset of any possible, say the birthing mother has an early onset of the flu. We can detect that now through coughing in a phone. If they have potentially may have COVID, if they have some COPD, so we understand what's going on in lungs. And this is not new rocket science that we've created. So back in the COVID days, I was already doing all this. So now I incorporated that into this platform. So that's the genesis of. So you can go online and see videos of me on the news about my tools to help people stay safe from COVID. So I took that knowledge from going on 6 years now and put it into this platform. And then with ISO Notes, we're now able to track a whole medical history of somebody. And therefore, with AI tools, now we can go back and look at that and say, okay, how is this birthing mother, how is she feeling today because of the notes they put into the platform? And therefore, are they depressed? Are they encouraged? Are they feeling pain? So we'll track all that, and AI will give you an early warning of what the actual issue may be.
Thank you so much, Derek. This is for the HIPAA compliance part. The slides mention HIPAA compliance and privacy first care. What are some best practices doulas should follow to protect client information in digital spaces?
Thank you so much for that question. Encryption is your best friend. Making sure that you're using encrypted communication. That's a matter of changing settings on your emailing and on your text messaging systems. Like you could do that, no problem. And then also just making sure that where you store it is secure, and it's not somewhere that you have to worry about anyone hacking into. And so there's easy, doing it in Doula Notes for one. Keeping all your stuff in Doula Notes is a great way to present, to keep your information secure. But then also just taking the necessary measures to make sure that all your communications are encrypted as well. I hope that answered the question.
Yes, thank you, Chanel. In that light, what are the common compliance mistakes doulas make with privacy?
For me personally, I think they some examples is like posting on social media without having full consent. When it's thinking that verbal is not just enough, it has to be written. Legally, you want to make sure that you set yourself up for success and not failure. And so it just should be a part of your paperwork that you normally give out to all your clients. And even if they say, oh, no, it's fine, I'd be like, wonderful, just sign the line. We're just going to make sure because they do have a right to revoke it. And so you want to be able to document everything. Documentation is so important, especially moving forward as providers, because you want to make sure that what I say is the contract is not just for me, it's for you too. So you can hold me accountable to the services and what I said I was going to provide. It safeguards you as well. And so that if you feel like I'm not doing what I'm supposed to do, you can come back and be like, but in the contract it says, right? And so those are some of the simple things that I find, especially if you're working with friends and family, blurring the lines of professionalism. I think that's one of the main things I see, that it's very easy to blur lines when it comes to supporting friends and family and people and losing that level of professionalism because of the familiarity, can't speak, but because of the familiar relationship. So I always say some of your hardest clients will be your friends and family because you're so close. But you still have to maintain the integrity of your professional title as a provider. And so that's my recommendation for everyone is you're a professional, and you're a professional in every space you find yourself in, especially if you're operating in the capacity of a birth doula. So don't compromise, okay? Just because they're friends and family, we still have to be professional.
Thank you so much, Chanel. One last question. In what ways can data collected through platforms like Doula Notes App influence maternal health advocacy and policy change for Black and Brown families?
And so from the standpoint of the work that the Health and Welfare Council does, that was one of the focuses, as well as in creating doula notes, is that we'd be able to aggregate from the experiences that doulas have had with patients. We'd be able to aggregate information to say and be able to show, we all know it. Those of you that are there and those of you that are doulas, you know the work that you do is so important, and you know birthing outcomes change and the trajectories change when you are engaged with a birthing person. And so being able to have it from a standpoint of a research, to be part of research in an IRB, that is something that is going to is powerful and impactful. And so from the standpoint of being able to push legislation, being able to have the data and statistics that are associated with the work is extremely important. So that was, an impetus behind the creation of the platform, in addition to being able to remove the administrative burden for doulas, but we'd be able to have the research and data and statistics to be able to support the advocacy.
Also, can I just add, as a doula who's out there in the trenches, along with Health and Welfare Council and all the other advocates in New York, like, we do need the stats. We do need the proof to show that the work is being done and how it's being done. And are we improving outcomes? Do we see downward trends in C-section rates when clients have doulas versus not? And all those things really do make a difference and show our value and show our worth. And if we have documented proof that, like, clients are like, oh, I'm so glad I had a doula. Oh, my doula helped me get to the help I needed for my maternal mental health, perinatal mood disorder that I was experiencing, like, all these things will matter, and we'll have proof of that, through Doula Notes. So it's wonderful. It's a great opportunity.
And I want to say that we know, like everyone on here, we know the value of doulas, right? And I understand from the standpoint, like, we shouldn't have to prove it, right? But it's unfortunate. There are environments and ecosystems that we exist in that you do have to have the data and statistics to be able to support. And so when we first created, when we first engaged with focus groups with doulas, from the New York State perspective, it was the doula reimbursement is not like my private pay, right? And the doula reimbursement for Medicaid is not like my private pay clients. And so for us to be able to get to a point of increasing that, have the data and statistics, and then there's not a question. When you go to advocate and you're able to show 90% of the births that were with doulas had this outcome, and without doulas had this outcome, there's not a discussion then that needs to be had. The facts are the facts, and it just presents us and positions us so well in the advocacy space.
Thank you so much, everyone, for answering the people's questions. Joy will come in now and make some announcements.
Thank you all for a great masterclass. This was definitely needed. And we definitely hope to have you guys back. So just a few announcements before we wrap things up. In the month of May, we do events like these all the time. So the next event that we have coming up will be on May 13th. We'll have our membership orientation event, which is for any doula who is looking for a place to call home in this space. This event is great for you to know what you get out of your membership. The other event that we have coming up is Journey to Doula World, which will be on May the 20th for any new aspiring doulas or birth workers kind of looking for what's next in their journey in the birth work space. That event is for you. And then we have our Practice How You Doula, which will be over PMADS with Imani Byers. So any doula that's interested in learning more about how to handle PMAD with your clients and things like that, this is an amazing event for you. Thank you all and have a great evening.
Take care. Blessings.